This week on Bulldog, we're going to go over a thorough Bulldog exam, nose to tail. All the things that we should go over and some of the things that ultimately are missed. So we're going to start, I always start with the nose. Any Bulldog, we're going to start to see, do they have what's called the stenotic nares. In this case, we do have a stenotic nares. You can hear the, or the snorting in. So then we go to their facial folds. This is a good opportunity for me to talk to owners about if they have a really prominent facial fold, like in an English Bulldog, some of the preventative measures we can do. We can move up to the eyes. With the eyes, I always go right to the eyelids. In previous blogs, we've mentioned dystechia, entropion, cherry eye, dry eye. This would be a good opportunity to review all that. And we'll kind of move back here, go to the ears. This is a good opportunity to discuss, do they have an active ear infection, some preventative measures to prevent future ear infections. Then I'll kind of slide down here, ultimately lift up the lips. Most Bulldogs, again, predominantly English Bulldogs, will have a good underbite. That's a good predisposition to dental disease. There's a great opportunity to talk about dental prophylaxis, good finger brush, something like that. I'll slide under the chin. A lot of Bulldogs will have chin acne for a lot of predisposing causes. And then I'll kind of slide around and look at the lymph nodes, just make sure none of the lymph nodes are enlarged. Slide back. This is the point where I'll usually talk about weight. My goal, I always want to feel ribs. I always want a nice tapered waist. So if you have that nice little taper right here and I can feel these ribs, that's ideal for the Bulldog. Slide my hands down, kind of feel each limb just to make sure we don't have any lumps or bumps. Good opportunity to talk about, are they limping, are they doing anything else? This is about when I'll listen to the heart. What I'm listening for arrhythmias, which is the rhythm of the heart, and we're listening for a murmur. So if it's a young puppy and I hear a murmur, I'm worried about a congenital thing. If it's an older Bulldog, I'm worried about an acquired heart murmur. After that, kind of slide my hands back. If it's a male, we'll usually bring out the penis. We'll look for what's called a penile prolapse, where it looks like a little red donut. If it's a female, we'll slide her hand back, and in the back, we'll look to see how her vulva shape is, see if she has what's called a recessed vulva. Then we'll move up. In English Bulldogs, we're really going to focus on their tail fold. This is really the fingerprint of every Bulldog. If they have a really bad tail fold, that's a good predisposition for, as we've talked about, bacterial infections, yeast infections, and fewer problems. Frenchies usually don't have it, but English Bulldogs definitely something we'll talk about. And then the thing that ultimately is missed a lot in Bulldogs is their knees. So what we'll do is I'll always check their patellas, or their kneecaps. And a lot of these guys will have what's called luxating patellas. And that's a predisposition, breed predisposition that they can have. If you don't look for it, you won't find it. It's typically something they're born with, so it's definitely something you want your vet to go over. And then the final thing I'll do is kind of comb my hand over, talk about their coat, and then I'll go in between each digit. And a lot of these guys are predisposed to interdigital cysts. So again, a good thorough exam. We're touching from the nose all the way to the tail. At the end of it, we should be asking ourselves, what thing as an owner should I do preventatively to prevent some issues from coming in? So hopefully that helps, guys. Any questions, definitely let me know. Take care.